Hello to all and welcome to this seminar of today. Welcome for everybody joining this session. We will present today a preview of the 2020 Future Health Index with the exciting title, The Age of Opportunity. We will present this or launch this at HIMSS on the 5th of March, and this is really a preview to give you the details already now. My name is Kimpen. I'm the Chief Medical Officer at Philips. My team and myself work across the business to advance clinical capabilities and customer growth opportunities, and we help the company and the external world understand the healthcare transformation. I spent many years working in hospitals as a pediatrician and as a CEO, and in that role, I was very familiar with the challenges faced by healthcare professionals. For me, to move the needle in healthcare, we deeply have to understand all the people that are working in healthcare, the participants that are in the system all day. That is also why I lead the Future Health Index. We do this annually. We have an annual study done by Philips, commissioned by Philips, which seeks to understand the readiness of countries to meet the future healthcare needs of the nation. And since the present edition of the Future Health Index, the 2020 edition, is completely focused on young professionals, I am very glad that I have here in the room with me. I am joined by two young professionals who will be in a debate with me, in a conversation with me, and I will give them the floor now to introduce themselves. The first one is Joyce Sombroek. She is a medical doctor and a professional athlete, a former professional athlete. And the other one is Ruben Osnabrugge. He is the global strategy program lead for value-based care at Philips, but he just transitioned from the hospital into our company. So we are very excited to hear their views. But first of all, I give them the opportunity to introduce themselves.
First of all, thank you for inviting me to join this interesting conversation. I am Joyce Sombroek. I'm 29 years old, and I work at the emergency department at the OVG in Amsterdam. Like you mentioned, I've also been a professional athlete. Over the past 14 years, I've been playing field hockey at an international level. And with the Dutch national team, we became European and world champions, and we won gold and silver at the Olympics in London and Rio. Besides that, I've been named best goalkeeper in the world twice, which is something I'm really proud of and I worked hard for. Now I've quit playing hockey, both because I have a hip injury and because I wanted to finish my medical studies. But since I love working with teams and like to help people achieve their goals, I hope to go to the Olympics many more times, but then as a doctor. Last but not least, it might be nice to know that I've been an ambassador for several charities for over 10 years, all medical charities, and since January, I'm one of the board members of a charity for children with muscle diseases. So those are things that I'm interested in, and I really like to share my experiences from being a professional athlete to help teams perform better.
Fantastic. Looking forward to it. Ruben, up to you.
Thank you, Jan. So Ruben Osnabrugge. I'm indeed the strategic program lead value-based care here at Philips. So I'm leading the value-based care initiatives for the entire company, supporting our Chief Medical Officer, Jan Kimpen. Before that, I was a junior cardiac surgeon here in the Netherlands, but I also have a background in health economics and clinical epidemiology. So I have a PhD in the cost effectiveness comparing interventional cardiology procedures versus cardiac surgical procedures, bypass surgery versus stenting, or transcatheter valves versus surgical aortic valve replacement. So that's a little bit about my background.
Thank you, Ruben. So let's dive right into it. Let me introduce the Future Health Index in general to you first before we dive into the details of the topic of today. It's in its 5th year. The Future Health Index 2020 report examines the experience of young healthcare professionals, how they are trained, how that training prepares them for the life in the hospital, and how they are empowered to meet the demands of tomorrow's healthcare. And the challenges they are facing are really enormous. We all see them around us. There is a growing world population, a growing global population. Life expectancy has increased dramatically, which is a good thing, but which goes together with the emergence of chronic diseases, multiple chronic diseases. It has been estimated that that people that are older than 70 years old have 2, 3, often 4 chronic diseases at the same time. These extra demands on the healthcare professionals have caused almost what we could call an epidemic of burnout and stress-related employee problems in the healthcare sector. Healthcare professionals nowadays are working long hours, not only because the demand from patients is more, but also because there is a shortage of healthcare professionals. There are not enough nurses, not enough doctors to take on the big challenges of this increasing number of patients. And finally, but maybe one of the most important reasons for this burnout is that the administrative burden on young and also older healthcare professionals is increasing dramatically. Now, in order to get on grips with that, what this has of an effect on young healthcare professionals, we focus this year Future Health Index on this group of people. We surveyed nearly 3,000 respondents, 3,000 young healthcare professionals, all younger than 40 years, in 15 countries. This is the largest global study of its kind to date. We focused on them because we feel that this is the generation that is best positioned to pivot the industry to drive and accelerate value-based care. So it is crucial that they understand its importance and are equipped to deliver it going forward in their careers. We have to talk with them now. If we don't start listening to young healthcare professionals now, we will lose them on the long run. As digital natives, this is the generation that expects technology to help them provide both better care, more efficient care, but also manage their work-life balance better. Technology plays a vital role in their working environment, and combined with their passion for their medical career, for treating patients, for caring for patients, technology can have the power to energize the young healthcare professionals and to help them manage their life and do the best for their patients. Now let's dive into the results of the Future Health Index. And there are 3 clear themes that can be found in the results of this year, and we will discuss these 2 themes with Joyce and with Ruben as we go forward. Now let's go to the first theme, or maybe let's recap the 3 themes before we go into the first theme. The first one is the gap between the expectations that are there when these people are being trained as medical doctors or as nurses, and the reality of the day-to-day life in the hospital. The second theme is the love and hate relationship for technology. While young healthcare professionals love the technology, they are very frustrated by its current application. And the third theme that came out of this Future Health Index edition is the importance of the right working environment for young healthcare professionals. They want a different kind of workplace as their older colleagues. So let's take these 3 themes one by one. I will introduce them, all the 3 of them, with 1 or 2 slides, and then I will go into a dialogue with Ruben and with Joyce. Let's go first for the exploring the gaps between the healthcare education and the training. There are 4 gaps that we have identified in the results of this study. There is a skills gap, there is a knowledge gap, there is a data gap, and there is a gap in the expectations. I'm going to give you some numbers. When you will see the whole report, it will be launched the 5th of March, you will see much more rich data. But on the skills side, we can say that 44% of all the respondents say that their education did not prepare them well for being in healthcare later on. On the knowledge gap, when we ask questions about value-based care, almost 80% of the young healthcare professionals did not know what value-based care was, or knew only a little bit. They knew it by name, but not what the content was. And only 1/5 of them knew a lot about value-based healthcare. When we go to the third, the data gap is that more than a third of young healthcare professionals, 35%, do not know how to use digital patient data in their daily decision-making around patients. And the same amount of people, the same number of people were clearly overwhelmed by the data dump that they had to deal with on an everyday basis. And finally, the expectation gap. 41% disagree or neither agree nor disagree that the reality of their career lives reflects on what they were taught as a student. So let's see how our young people here at the table think about that. Let's start with Joyce. Joyce, when reflecting on these results, did you feel ready to step into the healthcare environment as a doctor after a training of more than 7 years, I guess?
Mm-hmm. Yes, I felt ready, and I have to say that in the beginning, you learn a lot. You build experience. You learn a lot from others, but it was also quite different than I expected. Of course, you have way more responsibilities. You have to work overtime, but also there were more administrative tasks than actual patient care, and that was something that I didn't expect. Due to the shortage of nurses that you already mentioned and a lack of beds sometimes, we spend a lot of time and effort into getting people admitted or getting them transferred. So I think those are some of the aspects, just like the complicated systems and like the financial and organizational aspects of healthcare that we have not been educated for very well.
And you talked really clearly on the bed shortage, and then you had to manage where to go with these patients. Is there also a higher demand at the patient side or on the family side, or is that something you don't recognize?
I definitely recognize that. People look things up on the internet and they expect everything to be possible and to happen quite quickly. So the demands, I think they are getting higher and higher. That's sometimes difficult for healthcare professionals as well.
Yeah. More for you as a young person than for a more experienced physician, you feel, or not?
Well, I think it's for everybody, but the young professionals are the ones who have most contact with patients on the wards and who see patients on the emergency departments. So I think they have to deal with it, and it might be a bit more difficult for them because they don't have that much experience, and some patients it might be easier for an older and more experienced doctor to tell something to a patient.
Ruben, let's turn to you. You were working in a very stressful environment, I guess, which is the operation theater, doing heart surgery. How do these results resonate with you?
Yeah, so that's right, and that's really what attracted me, the operating theater, and working practically, have real results, and then so what you don't realize that you actually, when you're starting off as a doctor, that you spend so much time indeed in those administrative tasks. So writing letters, ordering medication in the ward, whereas older colleagues mentioned to me, well, it used to be like, okay, we order Lasix and just say it to the nurse, and they just administer it to the patient. Now the nurse comes back and tells you, okay, please order it in the electronic medical record. And that seems like a small thing, but yeah, that really takes a lot of time, and sort of ordering of the medication and really being able to handle this electronic medical record. And as a young doctor, you might actually move from one hospital to another early in your career. They might have different systems. So actually, it really feels that you need to spend so much time in getting to know the electronic medical record, and that hampers, I would say, mostly the interaction with the patient. So there's less patient contact than you would expect. So even as a surgeon, that also does impact your.
Could you give an estimate how much? When I was still working as a medical doctor, I really had the impression that I spent like 80% of my time at the bedside. How would that, in your personal opinion, what would the ratio be now?
It depends on the specialty, I would say. However, I would say it's the other way around.
Yes.
Really?
So
I
20%
agree.
of the patient maximum. And then Joyce, as you're now working in the emergency department, I know that there's also a lot of ordering going on, and actually you just briefly touch on the patient. You learn to try to judge the patient quickly, I would say, but maybe, and then you have to do a lot of administrative stuff.
Yeah.
But I'm happy to hear what you think your experience is there.
No, exactly. That's what I noticed as well. Also, when I worked in internal medicine before, you have to write the letters. You have to fill in all these things in the healthcare systems. So you want to spend more time with patients, but you can't.
Mm-hmm.
We are going to discuss that a little bit deeper in the second topic, how health technology and digital technology could have a beneficial effect on that. But let's stay a little bit with the first gap between the education and the real life as a doctor. Ruben, you have been working in value-based care over the last 8 months, but also before when you were writing your PhD thesis. You know that the whole world is talking about value-based care. All executives have it on their radar. All the people in the companies are thinking about it. And then we see that 80% of the young people don't know the concept.
Mm-hmm.
What do we have to do to change that?
Yeah, I also found it a very intriguing fact that came out of the Future Health Index. I think value-based care, it's a very broad term, but what we do know is that it's here to stay. So outcome measurements becomes more and more important, risk-adjusted outcome measurement, but then actually payment will be attached to the quality, so to those outcomes. That's inevitable. It's in reality, it's not the case everywhere yet. There's still a way to go, but more and more hospitals, physicians will be judged upon that and paid on their outcomes. So it's really important for young doctors to understand that. Also, because it will impact their daily practice and the way they are paid for the work that they do.
Mm-hmm. Mm-hmm. Joyce, can I pivot to you again on that? On this data that 1/3, 35% to be exact, of the young doctors don't know what to do with the data, the digital data, or feel overwhelmed by it. Is that also an opinion that you have, or that you see among your colleagues, your young colleagues?
Yeah, sometimes you have to get, like we spoke about before, you have to get used to the different systems, and also you have to do some financial tasks, and you have to fill in a lot of checklists. Besides that, there's a lot of data available, and we don't always know how to use them. For example, if you have a patient that comes in from another hospital, it's difficult to see what's the relevant information. You don't have all the information in your system. You cannot always access the general practitioner's files. So then you have to call other hospitals and see if they can fax you some information. And yes, we still use the fax.
Yeah.
When you get the information, you have to type it in your system because it's usually incompatible. So those things make it a bit difficult to do your daily work. It takes a lot of time.
Yeah.
And I think some important information might easier be lost because it's a lot.
Yeah. So we will talk about it in a minute, but to make all these systems a little bit less clunky in the interoperability area might solve at least one of the problems.
Definitely.
Okay. So the fact that 40% of the doctors, the young doctors, say that their education did not prepare them well for the life ahead. Is that something you recognize? Is that, or do you say, okay, I had a good education and the rest I learn on the road?
I think it will be very hard to be completely 100% prepared during your education. Maybe I mean it is very maybe blunt to compare it with a driver's license, but you really learn it while doing it. Maybe that might be a bit frightening for patients. On the other hand, you're supervised well, and and that's how you learn. Yeah, it's really a profession of experience, I would say, and so you really learn on the job.
So it's a pledge for continuous education, in fact.
Yes.
Definitely, yeah.
But still, I don't want to lose this point yet. I think we could do more in the medical education. If you would have the opportunity to redesign medical education, are there some courses or parts of education that you would introduce in the curriculum, Joyce?
Yes, that's why I did a summer academy this summer with TIAS Business School, because I did not know anything about leadership, strategy, financial aspects, and healthcare management. And those things are barely being educated during the medical studies. So I think that's really interesting.
Yeah, and that if I say that should be delivered to every student, would that be okay? Not only for the ones that want to take a leadership position in healthcare.
Well, I think
because
it is
personal. It's personal in managing your personal life. It's personal leadership, or not?
Yes, it is. But I think also everyone should know something about how healthcare is organized and about value-based healthcare. And there was not enough attention for those topics when I was studying.
Okay, Ruben?
Yeah, I think you're right. It does impact your everyday practice. So why do you actually? Why do we register so much more in the EMR these days? Well, there might be all kinds of legal causes and financial causes. You need to order certain tests in order to have the right DRG reimbursed. So there's all kinds of things that you realize coming from medical school. At least I felt a little bit naive, maybe.
Beyond your expertise and also beyond your area of accountability.
Yeah, and then you come into the real world, and it seems that you have to do so much more.
So we talked already so much about technology. Let's jump into it in the second item that we are going to discuss today, and that is how we can harness this technology and we can handle this love-hate relationship that young professionals have with digital technology. And we will first look at a few of the results of the study. The first result is that the positive part of the statement is that nearly all young healthcare professionals, 3/4 of them, 79%, 74%, have the opinion that digital technologies are going to help them in their work, are going to help them creating a better outcome for their patients, a better patient experience. On the other side, if they look at what they have at their disposal now, it is pretty frustrating. 33% say that, or 33% of the data that they get are completely irrelevant. They still have to work through them, but they are irrelevant. Or they are not actionable. 40% is not actionable. One of the items that Joyce already alluded to is that the data are fragmentary. They are incomplete, especially when you have to hand over one patient from one doctor to the other within a hospital system, and for sure if you have to hand them over from one hospital system to the other. Now, a third finding in this area of the report was that portability of data would definitely help make them more alive and more actionable for young healthcare professionals. They are used that they have the iPhone or the iPad at their disposal all the time. It would also help them if they could have all the data all the time with them while they are treating their patients. And the last one was, and that's a very positive one, if we do this right, if we turn technology into a tool to deliver better care and to increase the satisfaction of healthcare professionals in the hospital, it could also decrease the workload that you have. And we talked already about the workload on administrative duties, on workflow duties, for example. And 80% believes in the survey that this will really be an advantage of the new technology coming on. So let's talk about this a little bit, and maybe Ruben, why don't you reflect on these data, and do they resonate with you, or do you think that it's a little bit off?
They do resonate. I really like technology, I like gadgets, and when you're in the healthcare environment, sometimes you're struck by how things are structured, taken care of, sharing of important patient information, as Joyce just mentioned. Sometimes, regularly things are being faxed between hospitals. And just to give an example that every patient might have encountered, so when you see a patient for the first time in an outpatient clinic, one of the things you want to know is their medication list. These are difficult names, right? So not all patients know their exact medication, but you need to have it. So the patient, it's on a computer, right? Well, it's not. Usually it's not. If the patient is there for the first time, it's not in the system. So you need to check, and then there's a conversation on, I use this blue little pill twice a day, and so that's like basic information that you want to have right at your fingertips when you're seeing a patient, and you're spending time on that. So that's just an example, and there can be many others, but so you really want to have the right information at the right time, and that will reduce your workload.
And how could this be integrated more in your daily work? Because both of you said I'm spending 80% of my time not in directly patient-related activities or patient contact. If you are going to embrace this technology, it's going to be more, or do I see that?
Yeah, I think we're currently at a time that we have technology. I wouldn't want to go back to the paper charts of patients, so it is an improvement. But the electronic medical records, they can be improved, and so we need to find a way that it is working for us, and not that we're working for the electronic medical records.
Okay.
So there can be improvements there, and that it will actually make it easier, and with artificial intelligence and extra analytics, that will leverage.
It should more be an integration between the computer and the human being, most probably, which we will also discuss later on in this dialogue. That the smarter you do this, the better you do the integration, the happier the healthcare professionals are.
And it will improve outcomes.
Yeah.
Yes.
You really believe that?
Yeah.
Do you have an example of that? How it could improve outcomes of patients?
Literally, the example with the medication check, it's very inefficient, but it's also very prone for errors. And that might be vital. But another very clear example from the cardiac surgical field, there can be a patient coming in from another hospital with a type A dissection, which is a tear in your aorta, and you need to have an emergency procedure then. And you need to plan that based on a CT scan, a CAT scan. That information needs to come from another hospital. And actually, their system, their imaging system can, but also cannot be connected with
compatible.
Compatible. So indeed, you need to get that information somehow. So that needs to be burned on a DVD. And as the receiving hospital, you need to ask, I really want to have this DVD, stick it to the patient, and then send it with the patient. And then, by the way, also some patient information quickly written down in a letter. And you can imagine, so you really plan an open heart surgery on that information. So I would say you want to have that readily available. That will reduce errors, will improve patient care, will improve also getting the patient, in this case, quicker to the operating theater.
I'm surprised by this because you just transitioned from the hospital to Philips quite recently. I thought these were stories from the 90s. They are still now?
I'm pretty sure it's in 2020 still. And
I recognize the type A dissection example that you just mentioned because I had a patient just a few weeks ago that had one, and we couldn't operate on that person, so she had to go to the AMC hospital. Then we needed to make a scan and type a letter really quickly because the systems were incompatible. And then probably they do the scan over if it's not possible to see all the right data and all the things they want to see. So even though it's a really acute situation, still you have problems based on data and on technology.
Did you send this DVD with the patient?
Yes, that was the first thing we did. After the CT scan, we saw it was an aorta dissection. And then we said we have to have the DVD as soon as possible. And we call the ambulance, and I type a letter, and we send everything with the ambulance.
And then how many computers these days still have a DVD drive?
I don't know.
So that's
So Joyce, this is a little bit of the negative aspect of technology and digitalization. What excites you most about the technology? Because that's what the survey also showed us, that 80% of you guys feel that digital technology is really going to help you in the future, and it's really going to improve patient care. And we heard only the negative part. What excites you? Give us a positive.
I definitely agree on the survey. I'm convinced that technology can not only improve quality, but also accessibility, reduce cost, and make it easier for patients to stay at home longer and to have contact with their physicians easier. But also, as a young professional, I think it can reduce the workload and the stress levels. So those are all really important factors and things that I'm very happy with, of course. I think it is important, like we mentioned, that the data is easily accessible and can be shared. But I think that those are things that we can work on as well. And I think that automated systems, AI, are really promising, and that new applications like teledermatology or, for example, Pokemon Go can help people to stay active or to stay at home and encourage positive behavior.
So the second question would be a little bit building on this one. What are you give a few examples, but what do you see as the biggest opportunities going forward?
So besides personalized medicine, I think that prevention is something really interesting. And like you mentioned, there are a lot of chronic diseases, there are a lot of mental health issues. So if we use smart devices, for example, and e-health for people to stay healthy as long as possible, that will be great. And Pokemon Go is just one example, and of course it's not a lasting one. But I think that's something that we should focus on. And by encouraging people to stay healthy, to sleep well, to eat well, to stay connected with others, I think we can reduce the incidence of chronic diseases, but also mental health problems.
Okay, let's pivot into the third item of today before we conclude and open the floor for questions. But we have one very, very important aspect still to cover, and that is to create the ideal healthcare working environment. Because we have to go somewhere, we have to improve it, we have to use digital technology in order to make the lives of our young people that we may not lose in the ecosystem more bearable than we do today. So let's look at a few results on this theme in the report. These numbers are quite staggering. When we asked in the survey if people had stress, work-related stress, or even considered about leaving their profession, 75% of them said yes. 75% of the young healthcare professionals regularly experience work-related stress, and 34% have considered leaving the profession because of that. And it's a little bit different if you're talking about nurses or general practitioners or specialists, but the general outline seems to be the same. Nurses have a little bit higher tendency to consider going to do something else than general practitioners or specialists, but still it's a high percentage in these last professions too. Let's go to the next one and look at the work environment, how that influences the way young professionals feel in their day-to-day life. We have categorized the hospitals into kind of three buckets. The first one we call smart hospitals, and these are hospitals that are characterized by a maximum integration of the human factor and the technology. Digital tools, digital technology, EMR, and other applications are almost automatically woven into the workflow of the human beings that provide the care. Digital hospitals are on a little bit of a lower level. They have very decent digital tools and applications, but they are not really connected to the workflow of the doctor daily. And then analog hospitals, and let's hope that there are not so many anymore of those in the world, are basically still paper-based hospitals. where the handover is very complicated because you just have to hand over letters and papers and faxes. We see that doctors are happier and more comfortable in the smart hospitals when digital tools are completely integrated in their workflow. The last set of results might already give us a sort of segue into measures that we can take to help doctors being more happy for their whole lifetime in the hospital. We have to create a workplace culture that is more collaborative, more stimulating working together in teams. And I'm sure Joyce wants to talk about that later on in this conversation. We need to provide young healthcare professionals not with the old, which we talk already about, not with the old clunky digital tools, but with the latest equipment and the latest technology that work real well first time. 88% of the respondents would work in a hospital that can provide that. And 89% would work in a hospital that fosters collaboration. 80% would work for a hospital that has a good reputation, and 75% would work for a hospital that creates a good work-life balance. So although these numbers are not very, very different, there seems to be a tendency to go to work in a smart hospital where digital and human interaction is maximal. So let's ask Ruben and Joyce how they see this. Ruben, you can compare. You have worked in the hospital. You work now in the industry. How do these results compare to your experience having made the move?
Yeah. So when I look at the results, I can see very clearly that what I already felt is that I think society has really changed. We have a different generation of people. That means also a different generation of doctors and other young healthcare professionals. And there's different drivers and values for this younger group of doctors. So, for instance, I would say there's some more emphasis on work-life balance. Also, maybe a little bit less. Enjoy hierarchy less. They would like to have a little bit more autonomy, a little bit more flexible work. And that is really a difference in the hospital. It's hard to make it more flexible, but there can be things that can be done to facilitate this younger generation, I would say.
Yeah. Now, now I'm going to ask the question of which you have all been looking out for. And that is the question to Joyce. Joyce, you have been a professional athlete. It will be the last question of this debate. And then we go into the summary and take questions from outside. You have been a professional athlete for a large part of your life. And we all know that this is a really tough environment. You have combined that with your medical studies, which is a performance on itself. What elements out of that ecosystem, the professional athlete ecosystem, could be applied to our healthcare system? How can we learn from you?
So first of all, I would like to say that there are a lot of similarities because in both environments you have extremely motivated professionals with grit, with discipline. In both environments you have to work together, to collaborate, communicate well. And of course, like you said, it can be tough because you have to deal with setbacks and have to be resilient and have to support and coach each other through those hard times. I think what we can learn from professional sports is investing more in team building, because if you look at how you can achieve the best care or provide excellent patient care, I think it's important that you collaborate well, you communicate well, and if you look at where things go wrong, it's usually because of miscommunication or something in that order. So I think it's important to know your own motives, your qualities, your pitfalls, but also those of your colleagues, and to talk about it, to share experiences, and to show your uncertainties, because feedback can only make you better and make teams work together. So I think those are a few things that we can invest in a bit more in most healthcare facilities. And of course, if I compare it to sports. And if I look at the reasons why we could stay on top of the list, stay number one in the world for over 6 years, I think one of the important things is that you have to keep on innovating, which we do in healthcare, and then also share the experiences and the knowledge with everyone so that it can become widespread. So keep on working together, use diversity, and continuously challenge yourself.
Okay, these are great insights. I think if we all could be professional athletes together with doctors, that would be fantastic. But it's only the happy few that can do this, or the wonderful few, I should say. So let's summarize before we go into the questions. I think everybody agrees that healthcare is transforming very rapidly, and we seem to be on a crossroads. We cannot keep delivering healthcare anymore like we did it yesterday. We have to transform, we have to change. And the generation that is going to do that is the young healthcare professionals. So it is not only worthwhile, it is of eminent importance that we listen to them. If we don't listen to them and we don't cater for their desires in their professional life, we will probably lose them. And we cannot let that happen because healthcare will crumble if we are losing these young people working in the healthcare system and caring for our patients. So since this is a preview and all the detailed contents will be in the definite report that we will launch in March the 5th at the HIMSS conference in Florida, let me give you some nudging on what recommendations could be, what we could do to help young professionals in a fulfilling and satisfying life and help them taking care of our patients towards a better outcome. In education and training, we should increase the focus on administrative and business management to ensure younger healthcare professionals are prepared for this side of their role. We should provide them with training on the use and interpretation of technology, and especially the interpretation and the management of data to ensure the maximal effect and the full content and potential of these data. We should build an understanding of the principles of value-based care already during the education, that it becomes a sort of second nature to the young people that are entering the healthcare professional workforce. On the technology part, we should invest in data sharing technologies that make them more usable and not as clunky as they are today, especially if you're handing over patients to another hospital or within the hospital. We should harness technology to improve both the work-life balance as well as the clinical performance, and we should work with payers to increase the pressure on the industry to deliver greater products with a greater measure of interoperability. And on the culture side, we should examine the decision-making hierarchy and the process, how the relations are in the hospitals. We should foster an environment and a culture of collaboration, and we should also enable flexible working systems. And it is possible. Even in my previous role, when we did pilots where we gave nurses or nursing teams the opportunity to make their own roster and make their life-work balance themselves, they were happier coming to work and probably also happier at home. And we should leverage technology to minimize stress and burnout. Now, before we are going to close this seminar, we have ample time for discussions that come in from the audience via the chat box here. The first one is, let me look at it. There's a question here that I'm going to read it. How do the presenters see we bring these insights into action and implement, breaking through the existing business models and also the political and financial walls in a fragmented healthcare environment? I think that is a very important question. We are living in the world of healthcare today, which is governed by politics, which is governed by payment models. How do you suggest as young people to tackle this?
I think that's an excellent question. It's Wendelin Lopik asking this question. It's great. So I think actually we are moving in a direction indeed, as we discussed, of value-based care. But that's not going to get there that quickly. I think there's a combination of payers, industry, healthcare providers, hospital systems that actually should emphasize that that's the way to go. There's a lot of interest in the healthcare industry from many different angles, business people, healthcare professionals themselves, industry then. And if you keep on emphasizing these themes, including data operability, because that's really key to get all those insights, then eventually you will get there. And currently it might still be the case that there's a lot of discussion by payers and healthcare providers on the queue, like the quantity of care and the price of care, and not so much on quality, but more and more that's the case. So it will get there, maybe not as fast as we would like to, but we will get there.
Okay, let me phrase the question differently to you, Joyce. You young people are going to make the world. That's not up to us anymore. How do you think you can influence policymakers? You know, we have tried a lot, the old way. You are going in the future the new way. How are you going to influence policymakers if you will be in a leadership position yourself, maybe in a few years?
So I think first of all, we need to realize these problems to see how the situation is, and I think it's important to connect with others, to discuss possible options, and also learn from other specialties, but also other markets. For example, we spoke about data. If you look at banking applications, they can safely protect and share data.
Yeah.
So maybe we can learn from others, and maybe, I'm not sure, but there's also a role for the government to make sure that systems are better equipped to share data. If you ask me what I would do, I would try and get everyone to take some responsibility. And besides that, I just agree with the things Ruben already mentioned.
Yeah. So you mentioned banking, that it is we can't imagine us going to a bank every week anymore to take out a check or to take out cash money. And you can do that everywhere in the world. Now, this is a segue into another question that came up. What is holding us back in integrating all these digital tools in healthcare? There have been papers written about it, but I would like to have your impression on it. What is holding us back? Why don't we do it?
I think healthcare is more difficult than banking. So there's all kinds of things to it. There's privacy issues, there's ethics, there's so many different stakeholders. So that makes it a little bit harder to do, and we need all these specialists in all these fields, especially also people with an ethics background to think on, what can we do, how can we do that, where does the data sit? We need to solve that.
And of course, new legislations as well, with all the smart devices and AI, for example.
Yeah.
I'm gonna refer to a recent editorial in the New England Journal of Medicine where this topic was discussed, and the author of that paper said it is because every transformation in the root cause of this is that every transformation that we try to implement in healthcare starts with the same premise, and that is that healthcare should be delivered between two human beings, a doctor and a patient. We start there, and then we start building on that. And he advocated that this might not be the good premise because patients and doctors could be disconnected in part of the patient journey because the patient can do a lot of things herself, and the doctor comes only in certain occasions. Would you support that vision?
Yeah. So what you really see is that patients are also customers. I would say almost. If you see that patients really interact with new technology, they really want to take care of their own health, not only when they're sick, but also in prevention. So there's more. I mean, there's more individuality or taking care of themselves or people in general. but that also counts for healthcare.
Yeah.
Yes, and I already see that happening a bit. And I think most people like it as well because you can be in control of your own health. Especially the younger generations are used to digitalization. So if they can chat to someone, or if they can decide on many things themselves, or have a smart device for diabetes type 1, for example, that the doctor can just read, and he doesn't have to come to the hospital all that time, I think it will benefit a lot of patients.
It's great to hear that you embrace these new technologies, because this adoption of these new technology in the clinical framework of doctor-patient relationship is not evident everywhere. Now let's move to the last question. It came up also on the list. Is you are the influencers of the future. You are working in hospitals or have worked in hospitals. What would you say to your leaders, the leaders of your hospital, the leaders of your department, the leaders of healthcare in general, how they should change or what they should do to keep you in the hospital and not lose you to something else?
I think it's important to empower everyone to pay attention to work-life balance, but also work on building winning and innovative teams, and give everyone some responsibility, make them feel appreciated, and build an open and trusting environment. I think that's really important. And then if I look at myself, I would love to work in healthcare industry for many more years, and especially if those things are things that leaders pay attention to.
Oh, that's very good to hear. That gives a lot of trust, Ruben.
Yeah, I can only echo that. It's really, I would say, the culture of between healthcare professionals. I mean, there's always a team feeling already, but I think that could be further improved, and that's really something that is special about hospitals.
Yeah.
And people in healthcare are very driven. They like to take care of patients, and that's.
And they should also take care of themselves.
Yeah.
Yeah. I think that's a very nice addition.
Let's leave it at that. That are wonderful statements. I see here in front of me two very motivated people that want to work in healthcare for a lifetime, and we really need you, because if we don't have you people in the healthcare system, it will not be there anymore in the future, and all these chronically ill patients need you very much. We will officially launch the Future Health Index as said in March, the 5th of March to be precise, just before the HIMSS conference takes place in Orlando. Please, if you are there in Orlando, find us at the booth 2701, as well as the HIMSS Interoperability Showcase and the Cybersecurity Command Center. Thank you very much for joining this webinar. Thank you especially, Ruben and Joyce, to be with me today. I really enjoyed the conversation, and I have seen two wonderful young health care professionals in front of me. I encourage everybody to follow our discussions and join the conversation both online and in the workplace. #FutureHealth. Thank you very much.